Hello. Yes, come in, come in. Could you just give me one moment to check my schedule? Okay. So, hello, good evening, and welcome. How are you feeling? That's great to hear. I am Dr. Kenshi, and from what I'm seeing on my schedule here, I will be handling your complex exam, which includes cranial nerve, eye, dental, ear, and skin examination. Am I correct? Great. Before we start, could you just tell me a little bit about yourself? Let's start with your name. You can even tell me 2 or 3 names if you want. Okay, those are some really beautiful names. How about your date of birth, your age? Oh, July. We were born on the same month. And now, from outside the examination, your favorite season? Ah, summer. My favorite one as well. We have some things in common. That's awesome. I am pretty sure we'll get along throughout this examination. Have you ever had such a complex exam before? No? Oh, understandable. It won't be any different. Just everything will be put in one exam. So let's start with the exam. Just to put my gloves. Okay, so let's start with your cranial nerve. So now I'm going to start with your motor functions. I'd like to start from the top to the bottom. So now I'm just gonna check your eye reflexes, how they are functioning. Okay, now I just want you to look up. Yes, very good. Now look down. Very good. Now turn your head to this side. How about to this side? Very nice. Turn your head as far as it'll go to this side. Okay. Very good. And now the same thing with this side. Very good. Okay. I'm going to be checking for any weaknesses on your chest here, so just relax. Yeah, this might seem a little bit strange. Do you feel any discomfort? No? How about here? Here? Right? Let me check your kneecaps. Okay, the response was normal. Did you feel any discomfort? Great, okay. So now, I just want you to close your eyes. I'm going to be testing your smell. Now I just want you to, yes, just close your eyes. I'm going to spray something around your head. I want you to identify the scent. Okay. Yes, have a smell. Okay. So what is it? Cinnamon. Yes, correct. Good job. Now again, close your eyes. Tell me what it smells like. Yes. It's really nice. Yes. Caramel? Absolutely. Yes, you're right. Okay, now your sense of taste. Once again, close your eyes and tell What does it taste like? Wild cherries? Yes, of course, yes. Good job. How about now? Just relax. Yes, this was water. It has no taste. You're absolutely correct once again. So far, so good. Good job. Okay, so now let's step into the sense of touch. So now I just want you to, again, close your eyes. I think this is going to be the last time you're going to close your eyes. So now I'm going to use a sharp and dull side, and I just want you to tell me which side are you feeling, the sharp or the dull side? Is that clear? Great. What was that? Yeah, that was the sharp side. It's not that sharp, but you get the idea. Can make a difference now. Yeah, that was the dull side. Good. The sharp side. Yes, the dull side. One more time. Yes, again the dull side. Absolutely. Good job. Now, I will be checking your peripheral vision. So now I just want you to tell me when my fingers leave your peripheral vision. Okay, good. Very good. Yes, and I'm just going to go a little bit faster. Okay, very good. Now tell me when they land in your field of vision, as soon as you see them. Okay. Good. Very good. Yes. Very nice. Okay. Now, I'm just gonna have a quick look of your eyes. So now if you just look straight ahead. I doubt that this light would be too bright for you. I bought it especially for my examinations. Now just look straight ahead. Alright. Very good. Let me get to this side here. Yes. Just keep looking straight ahead. Yeah, just relax, but at the same time focus. This is no hard task to do. Alright. Now I just want you to keep looking straight ahead as I'm going to go with the light from side to side. Are you ready? Great. Good. Very good. Perfect. That's it. Alright. Very good. Okay. Perfect. Your cranial nerve seems to be functioning as normal. Okay, so now let's step into the eye examination. Okay, so now first tell me, how many fingers do you see? 5, good. 2, 3, 4, again 5. How about now? 10, 2, 6, okay. 8. Okay, a 0. Yes, you're absolutely right. Okay, now I just want you to look straight ahead here. Right here. Okay, now I want you to tell me, by looking straight ahead at me, which of my fingers are wiggling? This or this? Let's do this. Good. Very good. Okay. Perfect. All right. Good. Very good. Okay. Now tell me, which is the first hand that moves? This one? Yes. This one? Yes, absolutely. Now let me just take this Snellen chart here. Next is just a regular vision test. Alright, let me just extend my pen. Alright, so now what I'd like you to do is just focus at this Snellen chart and tell me which is the letter which is the biggest that you can read. Yes, of course, read it for me. That's E, correct. Let's move to the next line. How about here? Can you see it? Right? F, B. How about here? T, O, Z. Absolutely, you're very right. How about here? L, P, E. Here? How about here? Can you hear? Can you see here? Ah, okay. Yes, that's T. Oh, you were facing some difficulties with this letter, but no problem. Okay, now cover one of your eyes for me. Yes, thank you. And read this letter for me. Yes. Okay, yes. Very good, impressive, lovely. Yes, perfect. Okay, now the same thing with the other eye. Could you just cover your other eye? Yes, okay, yes, thank you. And read this letter for me, this letter. Okay, yes, very good, lovely, outstanding, very good. Okay, so now I'll just do a little bit of a color test. So can you tell me this color here? Yes, that's white with a little bit of a yellowish, but yes, I can count white as a correct answer. How about my shirt? Yes, it's a dark color. You're absolutely right. You said it. Okay, so now just tell me this color here. What is this color? Purple, purple nurple, yes. How about this one here? Let me just get a little bit far. Yes, this is yellow. This time is yellow, completely yellow. Okay, now I'm gonna be having a closer and deeper look of your ocular nerves just to see if they're functioning as normal. Okay, good. I'll be using the less brighter light. I have other light here, but it's brighter than this one, you see. Alright. Can you look up? Up, 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 up. Good, good. Now look down, 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 down. Okay. Yes, very nice. Perfect. Now look to this side. And now to this side. Okay. Perfect. Now, just want you to tell me as soon as you see my light in your field of vision. Okay, That was a little bit too late, but no worries. It's okay. Good. Perfect. Okay, now tell me as soon as it leaves your field of vision. But let's make it a little bit more difficult. Look straight ahead and tell me when it leaves your vision, your eye vision. Okay, yes, very good. Perfect. Alright, now let me just have a closer look. Alright, can you focus on this finger here? Ignore the light, focus on the finger. Okay. Now can you ignore the finger as it's moving and focus on the light? Ignore the finger, ignore the finger, ignore the finger. Alright. Now, can you focus on this object here? Just focus. Focus as it's going around your eye vision. Very good. Good job. You're doing an amazing job. So far, so good. Now, can you focus here on the object and ignore the finger? Alright. Alright. That's it. Focus on the silver object. Okay, now focus on this finger here and ignore the object. Good, good, good. Good, good. Yes. Yes, that's it. Okay. So now, let's step into the dental exam. It's gonna be really quick, as I'm going to first have a look at your mouth, your throat, to get a general idea of what I'm dealing with. Okay, I'm gonna be using the brighter light. Okay, just open your mouth to say ah. Yeah, throat looks good. Yeah, that's looking really good. Let me just examine your mouth. You doing alright? Okay, just checking up on you. From time to time, there's nothing wrong in checking how my patients are feeling. Alright, now, could you just tilt your head up, so I can check your nostrils? Alright, very good. Now this here. Do you have some difficulties when you're breathing with your nose? No? Okay. Fair enough. Right. Okay, now just open up your mouth. Say ah. Alright. Let me just have a look of your gums and teeth for any problems such as cavities or erosion of the enamel. Alright. Gums are looking pretty good. Let me Have you experienced any toothaches lately? No? How about any cavities? Oh, the last time when you were a child? Yes, of course. We all had those when we were kids. It was absolutely normal. Alright. Does it hurt here? How about here? And here? And here? And here? And here? Okay, very good. Before I step into the ear exam, I'm just gonna have a listen to your heart and your stomach, just to see if there are any problems, any deteriorations. Now just breathe in and out normally. That's it. Good. Okay, now breathe in and out when I say my pace. Breathe in and breathe out. Again, breathe in and breathe out. Okay, now just breathe in and out normally again. And just have a listen at the side and on the back. Good, very good. Now, to this side. Alright, perfect. Now, I'll be checking your ears. So now, what I'd like you to do is just stay still. As this is a very delicate process, a very delicate examination, as I will be examining the outer and the inner part of your ears. Let's start with the outer part. Just hold still. I'm not seeing any build-up wax. Okay. No ear cleaning is required here. About here? Nope. No build-up earwax. Alright. Alright. Yes, very good. But of course, I'm gonna have a deeper look by using my flashlight. And I will be using this brighter light. Just relax. Alright. Very good. Now to this side. Could you just tilt your head to this side? Yes, thank you. Alright. Yes, very good. And lastly, what we'll do now is I'm just gonna have a general examination of your skin. But first, I just want to check your facial muscles, how they're functioning. Do you have another look of your face? Okay. Okay. Let me just check the eyebrows. Raise your eyebrows like that. Yeah, really wide. Really wide, wide. Yes, very good. Okay. Alright. Now, just want you to close your eyes tight. Close your eyes as you have to open them and don't let me open them. Okay, good. Okay. Alright. Now, can you just give me a big smile? Show me your teeth. Good. Okay, now pop up your cheeks. Like a blowfish. Good. Alright. Let me just have a look at your cheeks. That's it. Perfect. And now I'm gonna be checking your temples. Just be massaging them a little bit. Are you experiencing any discomfort right now? Good. Okay. Now, your jaw. It's symmetrical. I'm not saying any problems. No, not at all. Do you experience any difficulties drinking water? Okay, good. Now let me just have a one more look of your face. Oh yes, it's very clean. I admire your skincare routine. Do you have any skincare routine? Interesting. Well, interesting. I might as well take some advice for you to keep my skin clean as well. Yeah, that's a really good skin routine. I give a thumbs up to this. Alright, now let me just raise up your sleeves. Yeah, raise them like that. Good. And now just raise up your bands. Alright. Very good. And so you're probably drinking aloe vera. Yes, you took the words right out of my mouth. Right. Let me just record the results. Right. Just writing down the conclusion. It's really important I note it down there, record it. Okay, so that concludes our long, complex exam. Well, I hope I didn't bore you too much. So, to sum up everything from everything done, I can tell that everything with you is normal. Your cranial nerve, your eyes are in perfect, are in healthy condition. Your teeth are really shiny, really white. I didn't notice any erosion of the enamel or any cavities. Also, your ears are pretty clean. I didn't notice any buildup earwax. And your skin is pretty clean as your facial muscles are functioning normal. You overall are functioning normal. Well, that's everything from me. It was a really pleasant examination for me. Do not hesitate to come again to receive such a complex and, yeah, it's a little bit longer examination. So I hope to see you again soon. Have a great evening.